Well, this is our second session, and for the music fans amongst you, this unfortunately is not the famous mid-American guitarist. This is Carlos Centeno, who is a famous palliative physician from Spain, and his background in clinical research is considerable, and he's going to tell us about the barriers and opportunities to develop integration in palliative care in Europe. Carlos.
Thank you, Billy. Then my talk today is about barriers and opportunities to development and integration of palliative care in Europe. Then, first, I would like to tell you something that I'm very pleased being here. I'm very happy being here with all of you. With some of you, I have worked in the last 4 years, and my feeling today is difficult to say goodbye to this project, this wonderful work. I'm going to present something that is not my work, it's the work of ISPE. Then, as you know, the continuity of care in palliative care demands a collaborative effort between all actors involved in the care network. And if we are talking today about integration, it's because in Europe there is a lack of effective integration into the European healthcare system for palliative care. Previous studies of our group that was done with the first edition of the Atlas of Palliative Care in Europe showed that the main barriers are different between Western countries and East countries. For Western countries in 2006, the main barrier was the lack of education. But for Western Europe, the financial constraints and the poor availability of opioids was the main barrier. But as palliative care is evolving in Europe, today we need to see again the situation of the development of palliative care, studying the barriers and opportunities that are there, but today looking at the current issue of the integration of palliative care within the health systems. Then the aim of our work is to identify barriers and opportunities specific to the integration of palliative care, and also we want to see the relation between integration and the level of provision of service in each country. For that proposal, we adopt the definition, the working definition of the InSup-C project, because this is a sub-project of the InSup-C. The method is based on the EAPC Atlas of palliative care in Europe. With one of the two surveys that we did for this atlas, that is the qualitative one, the Eurobarometer survey, we asked to the national leaders about their perception about barriers and opportunities for the development of palliative care in their countries in Europe. Then, that I'm going to show to you today is the leaders' view dated in 2013. And in this study, 40 countries of the WHO region of Europe participate and send the information. The question that we used to explore barriers and opportunities was this one. Please list the three main barriers or opportunities to the development of palliative care in your country at the present time. Receiving the answer of the leaders of palliative care, we perform two analyses. One qualitative one is a qualitative content analysis using the 4 dimensions of the WHO public health framework, considering, in addition, which barriers or opportunities are specifically related with the integration of palliative care. After that, we perform a quantitative analysis studying the frequency of barriers and also its relation with the level of service provision. With this method, we received 150 barriers to the palliative care development in Europe. It was the answer of the leaders. That we can see here in the 4 dimensions is that mainly the barriers are related to policy and to education. Education in the first place and policy later. But these are the total of the barriers. And it's interesting to see that in Europe, that we could think is that the problems are more in the policy and education. The problems are not in the service provision. The problems is in the framework that we are working. It's interesting to see that today in Europe we can see that this is not the main worry, the availability of opioids. If we look only to the specific barriers for the integration, after the analysis, we have 50 barriers. And again, that we can see is that the main barrier is education, the lack of education in palliative care, and also policy is one of the 4 barriers. Analyzing these 50 barriers, that we can see here is that the more repeated barriers are the lack of courses and curricula, the most specific barrier. And after that is the lack of a certification for palliative care, the lack of one specialization for palliative care. 7 countries and 8 countries are telling that this is the main barrier. Because our question is, which are the main barriers? There are others, but that's the main. After that, we can see that the regulations are also an issue. And in particular, it's interesting to understand that many countries are telling that the regional health system, the different regional health system, can be a barrier to have equal regulation for palliative care in the country. And also the lack of a coordinator, a national coordinator, or a national policy well coordinated is also an issue. There are other barriers, but that are the main ones. If we look at the sentence that we repeat to the answer, we can see here that 8 countries, as Netherlands for instance, are telling that palliative care is not integrated in undergraduate, graduate, and specialist system of education for disciplines working in palliative care. In Portugal, they are stressing in the specialization. The lack of or absence of specialized education of health professionals in the palliative care is an issue. Portugal and 6 countries more. And also the explanation that I already gave about the situation of the decentralized healthcare system in Sweden and in other countries as Belgium, Finland, Switzerland, and Spain. Now we are talking about opportunities, the good news. And it's very interesting the comparison of barriers and opportunities. But that we are seeing is that half of the barriers are related with the integration. Of the opportunities are related with the integration. But it's interesting to see how the main opportunity is also in education. It's a barrier, but it's also one opportunity. The leaders in some countries are seeing that something is changing. For some countries, there is a barrier, but for others, it's an opportunity. And it's interesting to analyze the answers, because we can see here that, talking about education, that the lack of undergraduate curricula, it was an issue, as we already showed before. But here, there are 10 countries that are telling that this is the main opportunity for palliative care today. Something is changing in the university in Europe. This is that the leaders are telling in some countries and less. And also, we can see here 4 countries, perhaps countries that already have a specialization in palliative care that are telling us that is the main opportunity to have one certification already. Regarding policy, something is also improving here. 11 countries are telling that the regulatory framework is also the new opportunity for the palliative care development. In some countries, it's a barrier, but here there are also many countries telling that it's the new opportunity. We can see some sentence, for instance, people from Portugal are celebrating that they have already a new law for palliative care, the palliative care law. And other people from Austria, for instance, are telling us that the increased awareness of the need of palliative care in nursing homes, support integration in nursing homes, a master plan for children hospice, again integration, and palliative care with quality standards. Then we have also opportunities, good opportunities, in some countries are barriers, but in others are opportunities. Which is the relation of the integration at the level of provision of services? That we can see here is one comparison of barriers and opportunities according with the service provision levels. That we can see is that also for barriers and opportunities in both, in countries with a high or very high service provision levels, the problems of integration are more frequent. Then integration is an issue in all countries, but it's most important in countries with more advanced development in palliative care. Considering this, that there are different barriers and opportunities depending on the level of provision, we can understand better how we can develop palliative care in the countries. If we look only to countries with low service per million inhabitants, the data are from the ATLAS too. These countries are the countries of the low quartile of the 50 countries. In these countries, the leaders understand that the first need is education, but education in what? Education to the public, education from the media and the advocacy of palliative care. Also, they are asking about funding for services. And the opportunities is the change in policies that is happening in the countries. And also, they are looking at resources and infrastructures as an area of action in the future. In terms of opioids, also there is a need to improve the situation. But if we compare with the countries with higher provision service, that are these countries, this is the number of service per million, the study that we did in the ATLAS. It's interesting to see that some countries are talking for first time about research as one opportunity. And the priorities are different than the countries with low provision. Here, the priority is to increase the public awareness about palliative care. That's very interesting, and I think that is an area of action for the future. We have to think in this. We have to pay attention to the message of palliative care in the media, and also the priority is the inclusion of palliative care in courses and curricula in universities, and also the development of service and to have good plans for resources and infrastructures. In summary, that we are seeing here, that is the level of provision indicate different barriers and opportunities, but also our study suggests that in the view of leaders, better development of palliative care and better integration of palliative care is possible if professionals and students are trained in palliative care and have access to specialization in palliative care. And the expansion of business plan, resources, infrastructures, and also the policies, the regulatory framework, could be improved the integration of palliative care in Europe. That's all. Thank you very much.